Hello everyone, welcome back to the channel, and before we dive into today's breaking update, make sure you subscribe and share this video so more people can stay informed. Today's story takes us right into the heart of South Africa's most heated debates: healthcare, immigration, and the controversial role of Operation Dudula. The Minister of Health has just revealed the full details of a closed-door meeting held with Operation Dudula leaders, and the big headline that's sending shockwaves across the country is this: foreign nationals, regardless of nationality or legal status, will continue to receive healthcare in South Africa. And as you can imagine, the reactions have been fiery. According to the minister, the meeting was called in response to the increasing confrontations at hospitals and clinics, where Operation Dudula members have in recent months been staging protests, accusing the government of prioritizing foreign nationals over South Africans in the public health system. For months, Dudula leaders have been vocal, claiming that hospitals are overburdened, resources stretched thin, and citizens being turned away because foreign patients, especially from neighboring countries like Zimbabwe, Mozambique, and Malawi, are flooding the facilities. The minister did not mince words in his briefing. He acknowledged the pressures in the public health sector but insisted that South Africa has both a legal and moral obligation to treat anyone in need of medical care. He cited constitutional principles, international treaties, and the basic ethics of medicine. When someone is sick, bleeding, or in pain, you do not first ask for a passport, he said firmly. You save lives. That is the foundation of healthcare. The revelation immediately set off a storm of responses. Operation Dudula members, some of whom attended the meeting, reportedly pushed hard for a change in policy, specifically, for hospitals to refuse non-emergency treatment to undocumented foreigners. They argued that the current system is being abused, with some foreigners allegedly crossing the border just to access better healthcare without contributing to the tax base. But the minister stood his ground, saying that while the department will continue to look into efficiency, fraud prevention, and better border health controls, denying care was not an option. Inside the meeting, tensions reportedly ran high. At one point, sources say a Dudula representative accused the government of turning a blind eye to what they called medical tourism at South Africans' expense. The minister countered by pointing to the larger systemic issues: understaffed hospitals, outdated equipment, and funding shortages, problems he says exist regardless of foreign patient numbers. We cannot scapegoat foreigners for every shortfall, he was quoted as saying. We must fix the system for everyone. The decision to keep the current policy in place has sparked outrage among some South Africans, especially in communities where public hospitals are overcrowded and waiting times are painfully long. Social media is ablaze with heated debates, some praising the minister for upholding human rights, others slamming the government for what they see as putting foreigners first. Operation Dudula has vowed to continue its activism, warning that if the government refuses to change course, they will escalate their demonstrations at hospitals. Health professionals are also weighing in. Many doctors and nurses have expressed relief at the clarity in policy, saying that uncertainty over who they can treat creates moral and legal dilemmas. We are here to save lives, not check IDs, said one Gauteng-based doctor in a radio interview. But others on the front lines say they understand the public frustration. We can't ignore the fact that we are stretched to breaking point, a nurse at a busy Johannesburg hospital told reporters. We need more resources, and we need the government to address the root causes. The political ramifications of this meeting could be far-reaching. Opposition parties are already using the issue to rally their supporters, painting the government as out of touch with ordinary citizens. Some are even proposing legislative changes to allow for more restrictive healthcare access policies. Meanwhile, immigrant rights groups are applauding the minister's stance, calling it a victory for compassion and a reaffirmation of South Africa's role as a regional leader in human rights. But on the ground, reality is more complicated. In border towns like Messina, hospitals do face overwhelming demand from both locals and people crossing from neighboring countries. In major cities, large migrant populations rely on the public health system for basic care. Critics say this creates a situation where the system is being asked to serve two countries at once without the resources to do so. Supporters of the minister's position, however, argue that health crises know no borders, and that diseases left untreated can spread, ultimately hurting everyone. The minister concluded his statement by announcing that the Department of Health will work on a new monitoring framework to collect accurate data on foreign patient numbers, treatment costs, and the overall impact on the system. This, he says, will inform future decisions and help allocate resources more effectively. He also urged South Africans to remember that many foreign nationals working in the country do contribute to the economy and pay taxes, directly or indirectly supporting public services. Operation Dudula, for its part, has already released a strongly worded statement rejecting the outcome of the meeting, calling it a betrayal of the South African people. They have hinted at staging mass protests at key government buildings, and even hinted at taking legal action to challenge the policy. Civil society organizations are bracing for more confrontations at hospitals, worried that patients and staff could get caught in the middle. This story is not just about healthcare, it's about identity, politics, and the soul of the country. South Africa finds itself balancing two competing truths, the need to protect its citizens and the need to uphold its values. The health minister's decision to keep treating foreigners in the public system is a bold stance, one that will be praised by some and vilified by others. But one thing is clear, the debate is far from over, and the streets, as well as the hospitals, may once again become battlegrounds in this high-stakes national argument. If you've got an opinion on this, whether you agree with the minister or stand with Operation Dudula, drop your thoughts in the comments. This is one of those moments where every voice matters. And as always, stay informed, stay engaged, and stay safe.